someone who has over 30 years of practice as a dental surgeon. She is the director and dental surgeon, permit me to add general, at the Osagie Dental Clinic located here in Lagos. Welcome to the program, Dr. Mrs. Angela Giwa-Osagie.
Thank you very much.
It is a pleasure to have you once again.
Thank you.
So we had, I had you once on the show, and you gave a general overview of what dental health is supposed to mean, especially with regarding to how you had seen it in your practice. And today we are narrowing down on tooth decay. Tooth decay is such an important topic because I have a personal experience. I was telling you before the show that I've had my second left molar taken off, and then I still have another hole. Viewers and friends out there, sorry, but I must confess, I know that there are a lot of you who can relate to what I'm talking of right now. Talking about tooth decay, how common is it in your practice?
Tooth decay is the commonest ailment pertaining to the oral cavity. What is tooth decay? Tooth decay is when the enamel, which is the outer layer, the outermost layer of the tooth, breaks down due to the activity of acid attack on the tooth. Acid is formed because of the sugar intake in which we take in, and it reacts with the plaque, that is PLAQUE. The plaque is made up of the food stuff which remains on the teeth, plus the bacteria which is naturally present in the mouth, and the sugar plus the plaque produce acid, what is acid? Acid is very erosive and corrosive, and that acid, eats out the enamel of the teeth, and that is the beginning of tooth decay. The correct clinical term is dental caries, and that is the beginning of dental caries.
Okay, so you have rightly mentioned that dental caries, or tooth decay in layman's language, occurs as a result of the action on bacteria on food that has been eaten, sugars from food actually, that now interact with plaque.
Yes.
And when that bacteria acts on such sugars, acid is produced.
That's correct.
And when you mean enamel, in layman terms, you're talking about the white part,
That's
the
correct.
hard part of the tooth.
That's correct.
Now,
yes.
When I had the second incident, the headache was so bad. At a point, I was wanting to think, God forbid, do I have a brain tumor? So, diagnosis can be quite confusing, isn't it? In terms of making diagnosis of dental caries.
Dental caries can manifest itself in the form of pain. And that is what we call toothache. And pain from your mouth, specifically a particular tooth, indicates that there's something wrong with that particular tooth. Because of the distribution of the nerve supply to the various parts of our jaws, the pain you're experiencing may not necessarily be from that particular tooth, and it's referred to as referred pain. You may have tooth decay in the lower jaw, but you'll be feeling pain in the upper jaw. opposite the tooth that is bad. And that is called referred pain. When that happens, a lot of us just keep self-medicating, taking, pain-killing tablets, and it will go. And then it may come back, it may even keep you awake at night. And it is maybe at that stage that you decide to go and see a dentist. Whereas, maybe you should have gone for your regular 6-monthly checkup, and that small bit of tooth decay could have been detected at a very early stage when the decay was very tiny. So that's what tends to happen. We wait until it gets very bad, and it may have to be extracted, as you had in your case, whereas 6 months or maybe a year ago, it was just a tiny bit of decay, which could have been cleaned out if you had visited the dentist, and replaced, the cavity replaced with a filling, and the tooth ultimately saved.
Oh, well, a lot of us are guilty as charged for this particular crime. And I wanted to dwell on making a diagnosis more often, because the patients will come to us general practitioners, medical officers mostly. They'll come to us, and then I'm aware that in many parts of the country, once some patients just go and say, I'm having a headache, some doctors do not even care to examine properly, and next thing they treat for typhoid. And then that's how they keep treating, unknowing to such a patient that this is just a case of dental caries. So how important is it to be able to make this diagnosis right on time? You have talked about saving the tooth. How important is this factor?
It's very important. You know, you referred to the GP, the medical practitioner, a patient going complaining of pain, but the medical practitioner isn't thinking that it could be due to a tooth. I was reading the minutes of the recent NDA, that's the Nigerian Dental Association conference, which was held late last month in August. And one of the things that was brought up was that medical schools should teach a little bit more of diagnosis of dental pain than they are actually doing, because, as you rightly say, a lot of patients, their first call is to their medical doctor, not to their dentist. So if the medical doctor is able to do what you call differential diagnosis of the condition, then the patient would be referred directly to the professional who could deal with the problem, and then this sort of thing would be prevented.
Exactly, because prevention is always better than cure, yes. As it is said. But let's delve into management now. So once a patient has been identified and this patient is being sent to the dental surgeon, you had scratched the surface earlier on right here saying what should have been done. But there's a very big fear of pain, tooth extraction. What exactly happens when a patient comes before a big professional like you, a patient with dental caries, tooth decay as the case may be?
When the patient comes into a surgery, they have to be registered. So that is the first procedure. And then they are shown into the dental surgery. And I must say that 80% of patients who come in to the dental surgery. They are very intimidated by the chair, the huge chair, and most of all is the equipment, the dental, the drills. It looks like not even the noise, but just the appearance of these things that makes it look as if you're in a car mechanic shop. Even although I must confess now everything is so neatly fine-tuned that it's quite attractive. We have very colorful chairs. The drills are now small, and a surgery, the environment is very accommodating. Sometimes there is music. Some even have television within the surgery itself, where the patient can be sitting down and be looking at a program, or you can have earphones with music piped into your ear whilst you're being treated. Everything now is not as it used to be.
Compared to the early mid-70s when you first started, isn't it?
Yes. So the patient comes in, and the first thing that the dentist should ask the patient is, how are you? You know? Try and...
Importantly.
Yes, how are you? And what are you complaining of? And allow the patient to talk before you just, say, open your mouth. No, you need to have a rapport with the patient, let the patient be relaxed, and let the patient say what his or her problem, what they're complaining of. Having listened to the complaint, then you may say, you can, of course, you're going to ask, how long have you had this problem for?
Certainly.
And then thereafter, you said, okay, let's have a look at it. And I would advise that you don't immediately pick up the instruments that you're going to use, because that too frightens the patient. Maybe as the patient opens his or her mouth, you explain that you're going to have a light so that we can see inside your mouth, and then the patient will open, then you look, and then you said, okay, for me to see, to examine even further, I'm going to use these things, the hand mirror, the probe, and at each stage along the game, you explain to the patient what you're going to do. That is the proper way to approach treatment. To allay the fears of patients, because I can tell you that 80% of patients who come to the dental clinic are scared.
Yes, they are.
I often say to my dental nurse and everyone, even my secretary, whoever I meet, all of us in the clinic, I said, do you know what? I spend 80% of the time calming patients down, and 20% of the time actually doing the treatment. It's quite a stressful situation for the dentist, but we're used to it.
Okay, well, viewers and friends out there, I'm sure you've heard from the horse's mouth for all those things happening inside your mouth, especially as it has to do with your tooth, especially the holes. Do not be scared. You need to go there to get a dentist to check out what exactly is wrong with you. Like Dr. Mrs. Giwa-Osagie has said here, the tooth can actually be saved. I said earlier in the program that I have a little hole, and as she has rightly mentioned, I will ensure to make sure I check that out by next week before I get another tooth taken off at my young age.
Precisely.
Because I was scared that, am I going to have this one taken off again?
Yes.
And all of that. Now, one of the things that really causes the fear is the procedure proper, extraction. Extraction. And right after extraction, before our time is up, we're going to talk about prevention, which is very important. So the extractive process. And viewers and friends out there, you can follow this conversation on my official Facebook channel or on Twitter. I will ensure to post this episode on my social media handles, because I think it's something you should watch over and over. So talking about the extraction process itself, I remember that everything that you have said happened to me. I was scared, and I got the open your mouth, let me see, open your mouth. Even if I was a doctor, so I was treated with a bit of care. So I wonder, it was in the government setting, and I wonder what other patients would have gone through. So like, open your mouth, don't be scared. And then the tooth was going to be extracted, and I was really scared. And then first dose of anesthesia, second dose, I required some more, as it were. I had 4. But I realized that it had not set in, so perhaps we could have waited a little longer. And then mine was, the first one was a molar impaction. The tooth, sorry viewers and friends out there, a bit gory, but I noticed that the dentist had to call the dental surgeon. There's all supposed to be dental surgeons, but he couldn't handle it, and my tooth was practically plucked out. Because they tried to pull it, they couldn't. It was way in too deep. So how often do you see difficult extractions, and what is supposed to be done instead of just pulling it out the crude way?
Wow, thank you very, very, very much. I think I'm just the right person to answer your question. There are 1 or 2 things I think I need to say before I answer that. Tooth extraction is the very last resort
in terms of management.
Of management. That's the last resort in following on from tooth decay. Okay. So if you have to have an extraction, there are 2 types of extractions. We refer to one as a straightforward or simple extraction, and then we refer to the second type of extraction as surgical extraction. I guess no extraction is simple, but we compare a simple extraction and surgical extraction because simple extraction, after you anesthetize the area by giving the patient an injection, then you can just use the correct set of forceps. That's the dental instrument used to pull a tooth out. A straightforward, I don't want to use yanking, but a straightforward pulling out, and the tooth is out. There's a little bit of bleeding, you seal it with cotton wool, tell the patient to bite, tell the patient not to rinse so that you don't have excessive bleeding. That's one. Then the second type of extraction is surgical extraction, which is usually done as you had in your case, where you had an impacted molar. And what do you mean by an impacted molar? Or what do you mean by an impacted tooth? An impacted tooth is a tooth which does not have enough space to come out, and it's usually lying at an angle. It could be at a horizontal angle or a vertical angle, but there's not enough space for the tooth to come up. So it's either hitting on the tooth in front, it's half up, half down. We call it half erupted. That's what you mean by an impacted tooth. And to remove that, 90% of the time, you're going to have to remove a bit of the bone surrounding the tooth. Each tooth sits in a bony space, a bony cavity. So to remove, that's where the surgical extraction comes in, because you're going to have to do some minor surgery, cutting the bone away to make space for the tooth to come up. So the experience you had is because your tooth was impacted, and the dentist needed to remove the bone. For myself, in my clinic, we do everything, because my training, I don't know about the training these days, but as a general dental practitioner, in those days we did everything.
Surgery and
Everything,
all of that.
everything. The only thing that I cannot do is the major maxillofacial surgery,
Okay,
road traffic accidents where your jaws get squashed up. But we do a lot, in my clinic, we do a lot of surgical extractions. And usually because we've had to cut gum and remove bone, we end up putting the gums back together by suturing them. But I must also say that you talked about the injection. I wanted to say something about the injection.
Because some people drink alcohol, so,
Yes.
so dosages,
Yes.
appropriate dosages of anesthesia.
We use local anesthesia. We seldom use general anesthesia unless it's under a highly monitored condition, which I know that there are some dental practices in Nigeria who do that, but really it should be done in the presence of an anesthetist if you're going to do general anesthesia. It's not done in the hospital. But on the local anesthesia, from my experience, sometimes there are many different reasons why a local anesthetic may not work as quickly as you want. Number one, as you rightly say, some patients do drink a lot of alcohol, and that can affect the dosage of the anesthetic being used. Secondly, the supply, where we buy our local anesthetic materials from, the cartridges, in Nigeria, no dental material is manufactured. Every single dental material used in Nigeria is imported.
So Forex is affecting the business now?
Yes, I'm not going there yet.
Of course.
What I'm trying to say is that you have business people who use it as a business to import dental materials, and it comes to them in bulk, and they have to store it. Storage, that is where the big problem comes. You see, not having 24-hour light supply. In the daytime, yes, wherever they're storing these dental materials, you will have the air conditioner on, you will have, their generator will be on, so there is
power.
There's power, there's air conditioning. But at night, maybe the light goes, they're not there, no gen at night. And the temperature within the warehouse or wherever they're storing these dental materials is high. And it affects the vitality of the local anesthesia, so that it loses its potency. And in my case, personally, if I am treating a patient and the injection seems to be taking a longer time, I would say to my practice manager, who is in charge of ordering materials, which supplier did you get this from? And when she mentions it, I will say, aha. Then I'll say, don't use that one again, use another one. So when that happens, you just keep giving more until it works. But these are some of the challenges we face in Nigeria.
Okay, because our time is fast spent, just to round up, I'm sure the viewers out there want to know how expensive is consultation, because let's not say the procedure itself, but how expensive is it to be able to treat dental caries or tooth decay, as the case may be, and what are some of the preventive measures people should know, just to round up more? Well,
we didn't talk about, you talked about tooth decay, but we didn't talk about the fact that every tooth that is decayed has to be extracted. 90% of teeth that are decayed can be saved
Okay.
through fillings or root canal treatment or whatever other means. But the last resort is extraction.
You said so.
The cost of consultation.
I'm not saying you should say the cost exactly, but is it affordable to the common Nigerian? We know that everything is expensive, and you have rightly said the current forex situation affects the prices of dental material. Just for the viewers out there.
Well, I hope you realize that there is now a National Health Insurance
Yes.
Scheme and HMOs, health management organizations, that if you want to have private health insurance or you want to go through the National Health Insurance Scheme. Or if you are paid up members to these health schemes, then treatment, certain types of treatment, the commonest type of treatments are affordable.
Okay. Well, that's fair enough, Ma. The time is always short when we're having a very meaningful and quite exciting discussion here on the program. Our time is practically done. I'm sure we'll get you here another time to be able to zero in on another pertinent discussion as it has to do with dental health. Viewers and friends out there, I remain Dr. Ogenekere Ogidigbe. Thanks for joining us. This is where we draw the curtain on this episode of the program. Remember to follow me on my social media handles to be able to watch a repeat episode of this show.